my name is Gillian. I'm an MPH student in the Community and Public Health Practice concentration, and my ILEX presentation was entitled Beyond Out of Sight, Out of Mind, Considerations for On-Campus Sexual Violence Prevention Practices. During the program, I did my APEX Applied Practice Experience internship with the Title IX office here on campus, and I worked with Katrina Gary, who is the Deputy Title IX director. And I remember we had a conversation very early on in the internship where, we were talking about just the difficulties of working on Title IX and sexual violence prevention and how it can be really emotionally challenging, very taxing. And she said something that really stuck with me. She said, I think that as much as people might think this is depressing or, you just beats you down, I actually consider it really hopeful and optimistic work because my work is grounded in imagining a world that does not have sexual violence and imagining what that community would look like, what that campus would look like. And I think that really changed how I was framing my work, and I suddenly realized what we're doing is actually very optimistic. It's about believing that another world is possible and believing that it's possible to make changes to these systematic failures. And so I think that really stuck with me, and I've definitely carried that with me through this project. I think that the program does a really great job on focusing on structural inequities and ways that we can make things more equitable, make things more equal, and that has really, I think that emphasis really helps us to understand that, these things we take for granted, that certain people are more at risk for certain things, it doesn't have to be that way. And I think just through lots of classes that talked about, how do we address inequities? How do we address this gap? How do we, we see a gap, what are we going to do about it? I think that really helped me realize that as much as it can be really hard to research these things and just learn every week, time and time again, that these challenges are happening, it still does make you realize that while the challenges are happening, what we're doing is critical to making the challenges a little bit less challenging. And so I think that, just really focusing on that human element and focusing on things that are unfair but that could be made more fair has been really the guiding principle for me. The statistics show us that college students are at an elevated risk for being victims of sexual violence, specifically female college students, but everyone on campus. I also looked a lot at the statistics for queer students who are often left out of the conversation because we tend to view things in a very heteronormative dichotomy. And so I looked at, what are the numbers for trans students and genderqueer students on campus and how are they being left out of the conversation. And so I just really grounded the project in knowing that these are folks that are at an elevated risk and deserve better than what's happening right now in terms of protection. So seeing how people have kind of taken the classes and really used it to develop a specific expertise or kind of carve out a niche for them for themselves within the field has been great, and I appreciate the way that the projects that we've been assigned really build on that. And so you can leave here feeling like not only do I have sort of the broad public health master's level of expertise, but I've also been able to sort of narrow in on one topic that's interesting to me. And so because we do get a lot of freedom with choosing our topics, I think it's allowed us to kind of hone in on what really, gets us going about public health. I think that the most recent course I was in, the community-based participatory research class, was really incredible. I actually wished it was longer. You might not hear that a lot, but I did wish it was longer. It was kind of a compressed summer course, and I was like, I want a full semester of this. But really it was going into kind of alternative methodologies for research and how we can involve communities in research. So we talked about things like photo voice, which is giving community members a camera and letting them show you through their eyes what the problem is. We talked about different ways of interviewing. We talked about zine making, which was really interesting. So I think that was a great course.